Pediatric surgery is a very significant subspecialty of general surgery, and it's probably the last remaining true general specialty of all the surgical disciplines.
I've always wanted to become a doctor, to work with children. I wanted to operate. I love trauma and I love the government setting.
Surgery is a skill that's needed. It's essential. And a lot of children are dying without the care that they would have gotten if there was a pediatric surgeon.
It's amazing working with children. I love it. Their response to treatment is really rewarding.
I think pediatric surgery is an extremely exciting and relatively new field in this country, and I think it's got a lot of potential to grow, and I think that there's a future for us in it.
Our work as a pediatric surgeon is irrelevant if we didn't have our junior doctors to invest in our patients, both in a time point of view, in a training point of view, and an emotional point of view. I just want to put it out there that we are very grateful that we couldn't do what we do without them.
So without the young doctors and the young trainees in pediatric surgery, we mean nothing. They are ultimately the ones that are going to take the care of our patients forward in the future.
Our day starts early in the morning, maybe 5:30, 6, depending on how many patients we have and the patient load.
That involves seeing all the current inpatients and making a list of all the stuff that needs to be done for them. We then generally have a handover meeting at around 7 o'clock in the morning where we just discuss all the new admissions, all the stuff that needs to be done.
We make sure that every area is covered by a doctor.
We have a clinic that runs 5 days a week, so I'd either be allocated to the clinic and sit down there and see outpatients, some of which may require admission. We also have theatre lists that run almost every day, so could also be allocated to theatre, where we'll generally be operating until 4 or 5 in the afternoon.
We have over 60 nursing staff in the unit, so everyone's constantly changing shift, so the continuity and the communication is key. So a good day means good communication.
Also a good day is operating on patients and seeing them recover during their time in the ward.
I think my perfect day is to see my post-ops finally going home.
Or also seeing a patient in the outpatients department that you've operated on that's now come back looking great. That's a great day.
In the burns unit, we admit on average 55 patients a month. We don't admit children that have burns less than 10% total body surface area burned. So the children that we do admit are very, very ill. And it can be anything from a newborn who's been dipped into a hot bath to a 7-year-old who's had a paraffin gas explosion in his face. It's terrible to see them go through the trauma of taking them away from their moms. We put them in pain. We very often take them to theatre. We do in this unit about 44 operations a month. So it really is a very high intensity unit.
We man the casualty. We have a trauma pit. So this is where the patients first arrive. It's a receiving area where the nurses and the clerks would put them in the system. On weekends, on holidays, on special occasions, this place gets pretty manic and busy. This is the trauma casualty, specifically the resus area. This is where the sickest of children come, as well as the adults. It's a joint area where we use to resuscitate patients who are unstable enough not to be in the other parts of the hospital.
We've got big plans for the future. One of the facilities certainly that Baragwanath Hospital lacks is a dedicated children's emergency department.
Surgeons for Little Lives has had a massive impact on pediatric surgery and pediatric surgery training.
What has been created by Surgeons for Little Lives is a diamond amidst everything that goes on in our country.
Overall, I'd like to have a situation where I could come to work every day and have everything that I need to do the best job possible.
If you donate money to Surgeons for Lives, whichever arm of the organisation it goes to, you know that it's going directly to improve the healthcare of paediatric surgery in this country.
We are firmly committed to the future of the children of this country, and by investing in Surgeons for Little Lives, there is no doubt that you are investing in the children and the future of South Africa.